Have you ever felt that no matter what you eat, your stomach seems to wage war against you? Today I'm breaking down the distinctions between SIBO and IBS, two common yet commonly confused gut health issues. And in the second half, I'll highlight some ways to tell them apart with some at-home tests. Welcome back to the channel where we focus on all things gut, brain, autoimmunity, and inflammation. I'm Dr. Max. I grew up with Crohn's disease, IBS, SIBO, and a bunch of other chronic conditions. Today I help people like you overcome theirs. Small intestinal bacterial overgrowth, or SIBO, and irritable bowel syndrome, or IBS, can disrupt your life with very similar symptoms, but they stem from very different causes. SIBO is a condition where bacteria that normally resides in the colon grows into the small intestine, leading to discomfort and nutrient malabsorption. IBS, however, is more about the dysfunction in how the gut brain, or enteric nervous system, and central nervous system interact with each other, leading to symptoms without necessarily an overt infection like SIBO. Additionally, IBS is more of an umbrella term that is non-specific as to what is actually happening pathologically. SIBO is more specific. After all, it's in the name, small intestinal bacterial overgrowth. Irritable bowel is, well, an irritable bowel, but there are still overlapping symptoms between the two and ways to differentiate. So let's get into it. The first is the response to carbohydrates and sugars. People with IBS but not SIBO are generally, and I say generally, able to better handle simple sugars than people with SIBO or the combination of the two. You might have heard of the low FODMAP diet, which is often prescribed for both IBS and SIBO. FODMAPs are a group of easily fermentable foods like garlic and onions, but also complex sugars and carbohydrates like wheat and dairy. The reason why IBS patients react so strongly to FODMAP foods is largely due to how their guts, nerves, and muscles respond to these complex or hard to digest sugars. In contrast, SIBO patients tend to react to simple sugars and not necessarily foods that are difficult to digest. Why is that? This is because in SIBO, the problem isn't just the type of food, but the location of the bacterial overgrowth in the digestive tract. Since SIBO involves bacterial overgrowth in the small intestine, these bacteria will feed on the simple sugars, releasing gas and metabolites as their byproducts. Now, people with IBS can still be sensitive to simple carbs and sugars, but they tend to be more food specific and not as consistently symptomatic as someone with SIBO. So someone with IBS might react to apples, but be totally fine with grapes, even though both contain fructose, a simple sugar. And someone with IBS might have a day where they don't react to foods and another day where they do. So IBS reactions are more about specific triggers and overall gut sensitivity. SIBO often involves a more generalized reaction to carbohydrates due to the bacterial overgrowth in the small intestine. It's important to note that many people with IBS also have SIBO, and some symptoms can overlap no matter how much we try to distinguish between the two. But paying attention to the type of sugar you're consuming, whether your reaction is consistent and across a category of foods versus a specific food, can help distinguish. The second is how you react, or how one reacts to probiotics. For those with IBS, probiotics can often be beneficial. They help to balance the intestinal flora and can alleviate symptoms like bloating and irregular bowel movements. Contrastingly, for someone with SIBO, taking probiotics can add fuel to the fire and make the person feel worse. Introducing more bacteria into an already crowded bacterial milieu can lead to increased bloating and discomfort, some of the telltale signs of SIBO. This is because you're essentially adding more organisms into an already cramped space where they start competing for resources and space, exacerbating the fermentation process that leads to bloating and other symptoms of SIBO. The third is the abdominal pain, location, and time. People with IBS typically report pain in the lower abdomen and often related to bowel movements. And the pain or discomfort often subsides post defecation. So, having a bowel movement seems to relieve IBS patients of their symptoms. SIBO associated pain is more likely to occur in the upper abdomen and doesn't necessarily correlate with bowel movements. This pain often arises after eating and can linger as the small intestine struggles the process and the influx of food and bacteria and their gaseous byproducts. The next category or way to differentiate is, are there weight changes and nutrient malabsorption? Unlike IBS, SIBO can significantly affect nutrient absorption, leading to weight loss and malnutrition. Most of your nutrient absorption occurs in the small intestine, and the bacteria in SIBO will consume nutrients from your food, depriving you of the necessary vitamins and minerals, which can lead to certain deficiencies. Now, someone with IBS can still have nutrient deficiency, but this is more likely going to be due to symptom management that involves dietary restriction or decreased food intake due to their symptoms such as nausea or sensitivity to certain foods. So some people with IBS who do have nutrient deficiencies is because they're just not eating enough. Quick story, a close friend of mine and former patient, let's call him Jake. He struggled for years with gut issues, and after various diet changes and countless doctor visits, he was still in the dark. He started a food diary revealing that his symptoms intensified regardless of eating low or high FODMAP foods, suggesting perhaps that there were simple sugars he still wasn't tolerating well, something more suggestive of SIBO. He then tried a probiotic challenge, which worsened his bloating drastically. Finally, a breath test confirmed high levels of hydrogen, a telltale sign of SIBO. So taking Jake's story and our symptom checklist, let's outline the steps you can take to investigate further. Number 1, you can try a probiotic challenge. Based on our discussion, try introducing a high-quality probiotic and monitor your symptoms closely for about a week. Any worsening of symptoms could be a red flag for SIBO. The second is doing an elimination test and having a food journal. Maintain a rigorous food diary for about 2 weeks, systematically cutting out and reintroducing various foods. Pay attention to whether you tend to react to simple sugars and from more than one food source. The third is the breath test. Breath tests directly measure the type and amount of gases produced, providing a clear indicator of SIBO. Jake's journey illustrates the importance of paying close attention to your body's responses and taking proactive steps towards identifying the root cause of your gut issues. So like Jake, you may need to experiment with different tests and dietary adjustments to truly understand whether SIBO or IBS is affecting your life. And remember, each person's journey in gut health is truly unique, which is why what works for one person might not work for another. So use the steps we discussed today as a starting point, but always consult with a healthcare professional to get a comprehensive diagnosis and a personalized treatment plan. If this video has helped you, please give it a thumbs up and share it with anyone who you think might benefit. Your engagement helps us reach other people struggling with similar issues and build a supportive community. Don't forget to subscribe for more content like this. Have questions or want to share your own experiences? Comment below. I'd love to hear from you, and I know other people would as well. Talk to you soon.